welcome. The program is Safety Train here on Lagos Traffic Radio 96.1 FM. My name is Taiwo Barua. I will be standing in for Fire Williams, who is unavoidably absent on the show this afternoon. And so on the show this afternoon, we shall be focusing on protecting our children's future, the dangers of skipping routine vaccines. My guest is very much with me in the studio. Dr. Adeoluwa Adeniji is my guest. He is the Chief Medical Director at Mekia Cancer Center, the first West African Comprehensive Oncology Center with PET CT-based treatment. He is a board-certified clinical and radiation oncologist with the West African College of Surgeons and the National Postgraduate Medical College of Nigeria, with degrees in medicine, human anatomy science, MSc, and business administration, MBA, in sustainability and e-commerce. He has also earned fellowships in management consulting and leadership. His extensive experience spans Luth Lakeshore Cancer Center, Marcel Ruth Center Cancer Center, and Sameda Clinics, where he has led clinical oncology services. He is an active researcher and advocate for cancer prevention with multiple publications and community screening programs. Good afternoon, Dr. Adeoluwa Adeniji.
Good afternoon. Thank you for having me.
How are you today?
I'm very fine.
I mean, with this resume of yours, it's not intimidating to me anyway, because I'll be trespassing if I'm being intimidated by this, because what am I supposed to be doing with this in the studio? So I am not intimidated. I come closer to the microphone. All right, then. Good afternoon to you.
Good afternoon.
How are you today?
I'm fine.
It's good to have you in the studio. Let's get down to business. I said earlier that we'll be talking protecting our children's future, the dangers of skipping routine vaccines. First, for the sake of those who do not even have an idea of what routine vaccine is or vaccines are, because I know it's not just one,
Yes.
right? Tell us more.
Okay, there are routine vaccines that children are encouraged to have right from birth. And commonly we have things like polio, that's oral polio vaccine, then the BCG, the hepatitis A, hepatitis B, then we have the one for measles, the one for vitamin, and so on and so forth, diphtheria, so many of them. They are routine vaccines, and they come in their categories at different age group. So, for example, at birth, a child can have polio, BCG, and then when they get to a particular, like 6 weeks, 10 weeks, and so on and so forth, to 6 months, a year, and even more than a year. So they have different appointments for different vaccines.
So what's the essence of these vaccines, and why can't it be administered just once? I mean, why do we have to, break it down into different ages, or,
Okay, so the way it works is that there are what we call the antibodies in the body. Those are even the antigens. Let me just use some simple thing. The essence of the vaccine is to strengthen the immune system, immune cells within the child to fight against certain types of infections.
Okay.
So when you introduce some of these vaccines into the body, you are building the immune cells within the body of the child. When the infectious agents that can cause certain infections get inside the child's body, so the child is able to fight it. So that's why they are preventive vaccines, and that is the whole essence. And the reason we don't give them once is because certain vaccines, let me just use the word, may expire in their efficiency at some particular time. So you want to reinforce by giving the same or different dose at different times.
Make me understand, because in this part of the world, I mean, some people are believers that, okay, they cannot allow anyone administer injection on them. I mean, the breast milk is sufficient, to build antibodies. You can do vegetables, you can do all sorts. Where is the place of all of these? Why do I have to, be vaccinated when I can go natural?
Okay, so I would say this. There are certain antibodies or immune cells that the children, babies, when they are born, can get from the mother. For example, when a child is born at the first few weeks of life, you may not want to give what we call the tetanus because the mother got it while she was pregnant. And then the baby is kind of protected. But it got to a particular age in life that the child needs to get his own or her own to be able to build enough immune cells to be able to fight tetanus. So the natural things will not automatically get into the child. And there are things that people do now that are not actually building the immune system. They are just doing it because of what they think will be effective. So
things like what?
So, for example, there are people that take ginger and then they take some alkaline water. They believe those things are going to build immune systems. And some of the parents are even giving their children, babies, that don't need anything like that. Those things can even, expose the child and make the child to be exposed to certain risk. For example, if you alkalinize a child's body fluid, what it means is that you're changing the pH of the blood or of the fluid within the child. So at the end of the day, the child may not be able to withstand certain infection that normally the body would have taken care of. So what we do with the routine vaccine is we give the child what they need per time, and then the child is able to withstand the infectious agent per time, and as much as possible they are free from the infection.
All right, these vaccines, they sound like a norm, right? Oh, vaccine, oh, these are very adjusted, this and that. But you see, what are the risks associated with not administering or not taking these vaccines?
Okay, that's quite straightforward. Let's assume that a child doesn't receive polio vaccine. For example, that's common in some part of the country, or it used to be common, but now things are getting better. So that means that child is at risk of developing poliomyelitis, as it were. Or a child that didn't receive vaccine for tetanus will develop tetanus at some point in life. Or a child that didn't receive vaccine for measles at some point will develop vaccines. And what that means is that the infectious agent, let's say the measles, that ideally shouldn't even kill the child. The tetanus should not kill the child because the child doesn't have that immune system. The immune cells have not been boosted by vaccines. So that child is exposed to tetanus, and at the end of the day, the child dies of tetanus, which shouldn't be. So when a vaccine is not given to a child, that child is at very high risk of having injury or death from that particular infection. So which is a big one.
All right, Lagos, Nigeria. You're tuned to Lagos Traffic Radio 96.1 FM. You are listening to Safety Train, and this afternoon we're talking protecting our children's future, the dangers of skipping routine vaccines. Quickly, let's tell you that the roads are still looking very, very appreciable. We want to keep it that way. Ikorodu Road is still good. Lagos Ibadan Expressway is still good. But then let me tell you what's happening around the Buteru. Very good one. Descending CMS Bridge in Wodofin Canal to Ijara Olokpa by NEPA. Stadium Broad Street to Akpogmo, and then is the bridge to Ofin Canal and Olubowo. Eko Bridge, Akpogmo, CMS, Elegbata Mini Stadium, Ibuteru, all looking free at this time. All right, you're wondering who I have been speaking with. I have with me in the studio Dr. Adeoluwa Adeniji. He is an oncologist, right? All right, then, so let's move on now, Dr. Adeoluwa. HPV vaccination, does it prevent cervical cancer?
Yes, very well.
What are the chances?
So the chance or the probability of prevention is almost 100%. That means we're talking about 99%. For example, there are different types. There is the newest form which covers almost all the strains of human papilloma virus. That's HPV. We call it non-valent. So it covers almost 9. And that means if an individual is able to have that, the chance of developing cervical cancer in the future is almost 0. And that is the beautiful thing about, cervical vaccine. The one we had before, which was bivalent, Cervarix we call it. Cervarix could cover just 2 strains out of numerous strains. So at the end of the day, it prevents, reduce the risk till about 50%, kind of. Then it was developed and improved to become Gardasil, and then Gardasil improved on Cervarix. Now we have Gardasil 9. Gardasil 9 gives you almost 100%, prevention.
When you go to the hospital, especially the mother and child unit or any hospital, you hear about routine vaccines being administered, to children. Basically, routine vaccine, people see it as it's meant for children. As adults, aren't we supposed to be having routine vaccines also?
Okay, so
I'm only asking.
Yes, the reason we call it routine vaccine is because it's meant to, to start from birth, and as the child grows, the child keeps getting it. But the idea of human papilloma virus, HPV vaccine, it starts with children from the age of 8, 9 these days, and it applies to both boys and girls. Okay. And the whole idea is to ensure that the lady doesn't have it and the guys don't give the ladies. You understand?
Okay.
And then, but when we get to the age of 20-something, we try not to do it because the effectiveness is reduced significantly. However, there was a review that was done and said, okay, instead of stopping at the age of 20-something, why don't you extend it between 25 to 45? At least there will still be some benefit. It may not be that much. So, and these days, we encourage people between 25 to 45 to also get Gardasil 9 as much as they can. And in this age of COVID, there is now the one we call the COVID vaccine. COVID vaccine has been introduced into the routine vaccines, especially in the western part of the world. We are still fighting that in this part of the world. For example, a child from 6 months can get COVID vaccine. And that is really interesting. So HPV vaccine has been part of their routine in the Western world. Now COVID vaccine has joined. And I remember last year, Lagos State government introduced cervical cancer vaccine, like HPV vaccines, that people can have it free of charge. Because WHO wanted us to reduce cervical cancer to 0 level. And now Lagos State government is working towards that, which is a good thing that we should actually commend the government on, and then let them know that they are doing a great job. So apart from that, in this part of the world, HPV vaccine is still not, I would say it's still not part of the routine, because people are still doing out-of-pocket payments for HPV vaccine, unlike the other routine vaccines that are given free, almost free of charge in government hospitals. But COVID vaccine is not in yet, so which I believe over time we'll probably get there very soon.
With these routine vaccines, they are in stages. If, say, for instance, someone misses the first stage or the second stage, can the person actually, take the third stage? Maybe that's when the person is available, or the person would have to take the first and second before graduating to the third.
So what we do with vaccine is that as soon as you catch them and they are available, you give it to them. Even if they missed the earlier scheduled doses, then you can just go ahead and give them what you can. At least they can get some benefits at that point.
Okay, so we have all of these routine vaccines. We've had it since, time immemorial, right? Why do we still keep having these preventable diseases still occurring in our communities, and they're still deadly?
Yes, the reason you have people come up with some of these preventable diseases is because there are individuals who would not go to receive the vaccines, and they would not do that because of certain belief system, the myths. They believe the vaccine can make them to become sterile. They will not be able to have children later on in life, or the vaccine will do something spiritual or something else. So a lot of people, I remember in those days when polio came around, and especially in the northern part of the country, they refused to go for polio. So we noticed that the the risk of people developing polio in other part of the country reduced, except in the north. So they were coming down with polio. And now things are better. So when people don't receive these vaccines, they will have, preventable disease, what the vaccine should have prevented. The same thing applies to HPV vaccines. People don't get vaccines. In this part of the world, we still get to see cervical cancer in the hospitals, in high number. But when you go to the Western world, cervical cancer is almost zero. They don't even talk about let's treat cervical cancer.
Oh.
That is the truth. They talk about that type of cancer, like maybe cancer of the womb. But in this part of the world, when we talk about the most common gynecological tumor among the women, you'll be talking about cervical cancer. We shouldn't be. In the Western world, nobody talks about that anymore. Why? They receive their HPV vaccine when they are supposed to. But here, number one, people don't have money to have it. Number two, it is not readily available. Then number three, there are some belief systems that will not, encourage people to go for it.
Are we doing enough as health workers in sensitizing Nigerians?
I believe there is always room for improvement, but what we have now is much better compared to what it used to be. We have a lot of, the health workers who are all over the nation, different communities, rural areas, talking about vaccines. And also we have the NGOs, working together with the church, with the mosque, and everybody is working together with the government to reach those hidden areas, those rural communities, because they are the ones that, they are the ones that don't get to receive the vaccines as they should. So there's a lot of collaboration going on. And I believe that the health workers are doing a lot, and they will keep making things better.
All right, Lagos, you can be a part of the conversation this afternoon. The number to call is 0915-387-7127. 0915-387-7127. We are talking protecting our children's future, the dangers of skipping routine vaccines. My guest is Dr. Adeoluwa Adeniji. Dr. Adeoluwa, are vaccines safe for children? What are the side effects parents should look out for? I remember during the COVID, vaccination, a lot of people actually mentioned some effect. Oh, I slept. Oh, I had headache. I had this. Let's talk about the effect of vaccine.
Vaccines are very safe, especially the ones that have been, tested through clinical trials. Over time, let's even talk about the routine ones that we are used to, the polio, the measles, that's the MMR and the rest. They are all safe. They can have side effects like maybe the person has some fever, mild fever, or some headache and body pain and things like that. But they don't stay for long. Usually when people are taking their children for vaccines, they just put some drop of paracetamol, although that is discouraged now, that you can do that because it affects the effectiveness of the vaccine. So you can do it 24 hours after.
Whoop, 24 hours?
24 hours after.
Such a long time.
But, it makes the vaccines to work much better.
So what do you do when the child comes down with fever, running temperature?
If the fever is really much, then you need to take the child to the hospital. But if it's just mild one, you can expose the child. And if you need to do a form of tepid sponge, those are, home remedies that you can do easily. But if you think the fever is really much, then the child needs to see a doctor.
Return to the doctor.
Apart from hypersensitivity reaction, there shouldn't be any major side effect that should make people to be afraid. Then about COVID vaccine came in newly at that time. So a lot of things were probably not known or not experienced at that time. So at this moment, it is much better. So there's no reason to be afraid of taking vaccines. The side effects are well known and they all have remedies.
Tell me some of the myths that you get, that health workers get to hear about vaccines.
Okay, so the first one is the fact that it makes the children to be sterile. That means when they grow up, they will not be able to produce children. That is very common. In fact, there is one in the recent time about HPV too. The same thing. Polio at that time, And then people will tell you, okay, this is what it does, and they want their children. They want to wipe out their lineage, so they are giving them vaccines so that they will not be able to produce children, and because of that, their generations will no longer exist. Very common. And then there were some other religious beliefs that it has a spiritual means, a spiritual way of initiating people into the occultic, world and things like that. So many things that are not actually true.
So how can parents stay updated and keep accurate immunization records for their children?
So number one is to find out, to ask questions from the health workers. Number two is to ensure that the cards that are given to them, they keep their eyes on the date of the next appointment, and then they keep that date and they're in the hospital. If they have any concern, they should ask the professionals who will be able to provide the right information for them. And with that, they will be up to date. And if there is any new thing, these days, or people going to the Google and then WhatsApp group, and you hear all kinds of things, this can happen, that can happen. If you hear anything that will make you to be afraid, take it to the doctors, take it to the nurses, let them counsel you, let them tell you if it is true or not. Because whatever thing that is not published scientifically, it cannot be true.
Whatever is not published scientifically cannot be true.
Yeah, that is
well, we see how that pans out. I mean, I listened to a little girl once said to her father, the father told her, okay, I want you to be a medical doctor. And then she said to the father, why would you want me to be a medical doctor when I can actually go on the internet and ask the, so app that, what can I use for so thing? And the app would answer me. And I'm like, wow, we're getting there. So the likes of Dr. Adeoluwa, you have to start gearing up for the Gen Alpha. And what do you have in stock for you?
Well, with artificial intelligence, we are hearing all kinds of things that your doctors can just ask any question. How do I treat this? And AI will tell you all the drug combinations.
But isn't that the case? Let's even talk about AI. Isn't that the case?
The truth is that the practice of medicine is quite different from that. When you go to Google or you ask AI,
or any of the search
you're
engines,
going to have a lot of information. You need to know which one to pick. In the practice of medicine, there's something we call individualized care. What applies to A may not apply to B. So AI may not be able to give you that kind of specific information that will help an individual. You still need a doctor to look at the case, examine, and say, okay, this applies in this case, this doesn't apply in this case.
Okay, so those of you who want to consider homeschooling, you want to have your wife deliver at home because you don't want to expose your wife to a doctor or something, you might want to have a rethink. So how can, what support is available for families in rural or hard-to-reach areas, talking about a vaccine routine?
So there are...
routine vaccine.
Routine, yes. There are supports that the government is providing, and government is also working with the NGOs, then with some religious bodies, in order to reach this hard to reach. We call them hard to reach, or the hidden areas. Rural areas are in categories.
Sure.
So the support include we have what we call mobile clinic outreaches.
Okay.
People going with vaccines. And first of all, to sensitize them so they are aware, they accept, they're ready to allow their children to have it. Then they go with the mobile, clinics, including the vaccines, and they give it to them in different areas.
Let's talk about how vaccines are being moved around in this part of the world. Is it ideal? Is it safe, the way we see people carry vaccine around?
It now depends on who is handling it. I've seen some health workers who are able to, maintain what we call the cold chain to ensure that the vaccines are properly preserved. And they carry it in their small box, and they don't go far. They just move from their office to wherever street or communities they are, and they gather the people there, they attend to them, and they do it very well. However, I know there are individuals who probably want to make money from that, so they can do anything to make money. They just carry anything, even expired drugs. They move into areas where they will not be caught, and they do what they want to do. So such people should be arrested.
All right, then, all the advice to Lagosians and Nigerians for extension on routine vaccines as we wrap it up.
So I will advise everyone listening to me to encourage their children to get the routine vaccines, and also the ones that apply to the adult, especially the HPV vaccines and also the COVID vaccine. So as much as possible, do not allow your children to skip routine vaccines so that they are able to be without preventable disease. And also when you need to have vaccine as well, you should go for your vaccine.
All right, you have been listening to Dr. Adeoluwa Adeniji, the Chief Medical Director at McKeer Cancer Center. And today we have discussed protecting our children's future, the dangers of skipping routine vaccines on Safety Train. This is where we drop the anchor on today's edition of the show. Maximum thanks to Okwemi Shodun care of the social media unit. Big thanks to Victor Terry. Our executive producer is Taya Kwale. Remember, this program is proudly supported by Rely Supply Limited, providers of first aid boxes and training. For brand promotion on the radio or to access our services, call 0818-1313-156 or send a message to us on 0908-629-7109. My name is Taiwo Barua. The program makes a return next week, Tuesday, for another insightful conversation. To enjoy the rest of your evening, Lagos.